Hello and welcome to Yoga and the Massage Therapy Student. If you are a massage school instructor, if you are a massage therapist, if you are a continuing education provider, if you're a massage student in massage school, or if you're thinking about coming to massage school and having massage as a profession, this presentation is for you. So who am I? My name is Kathleen Hullen-Lisson. I am currently a lymphedema therapist. I am board certified in therapeutic massage and bodywork. I am also a yoga teacher. And I was employed at a massage school at IPSB Massage School as a teacher. I taught an upper level communications class in mindfulness, and I was a massage student. So if you're a massage student, I was in your place 10 years ago, walking into my first semester in massage school and trying to figure out how I was going to learn all the anatomy, all the physiology, learn how to massage people, learn how to be successful at this new career, and also pass the MBLEX exam. So in this presentation, we will look at research on the benefits of yoga for adult learners, research on the effects of yoga on the body and mind, the link between intuition and mindfulness, and also research on breathwork and the nervous system. But first, let's kind of take a step back and really get honest about the reality of students coming into massage school today. And that is that just like it was when I was a student, students are not always coming to class in the morning bright and early with that prepared to learn mindset. Students are distracted by devices. The outside world is interfering with their learning. These are adult students. Often they are not 18-year-olds. They have a whole life and responsibilities and the world outside and navigating all different types of things in their life. And that can interfere with their learning. And we also have to take an honest look at where the study skills are. Are their study skills that they had in high school going to help them be successful in learning this college level anatomy, physiology, and everything they need to learn for massage skills? And for me, this was a second career for me. So I was walking into the classroom at 40 years old, and were my study skills really going to help me that I remember from high school and college so long ago? What about our students' body awareness skills? School is not regular, education, K to 12 education. It is not necessarily teaching people about body awareness, and body awareness skills are definitely something that you have to be a successful massage therapist. And lastly, and perhaps most importantly, what about the concept of beginner's mind? So I didn't really learn about the concept of beginner's mind till I went to meditation teacher training. And it's this idea that come to every experience and every day of your life, every practice of your life with the beginner's mind, open to learning, open to, perhaps failing, open to not being able to do it correctly the first time, and not shutting down and just instantly saying, this is not good for me. I'm never going to be good at this. I just can't get it. And then kind of giving up. So the richness of the beginner's mind is something we desperately need for our students who are coming to massage school. So thinking about what we just went over, all the concepts of the obstacles that our student, the massage student, is facing as they come into class, and some of the things that we're going to look at in this presentation, I'd like to stop before we really dive into the research and take a mindful moment. So I'll invite you to get into a position that's comfortable yet respectful. Your eyes can be open or closed, and just take a few nourishing breaths. And recall bring to mind why you pressed play on this video. What is it that intrigues you about this topic? What are you interested in learning? And what positive things have you already seen? If you already have a yoga practice of your own, what positive things have you seen in your own life as a result of practicing yoga that you think would be valuable to someone who is attending massage school? And I'll just have us take one more breath together. And then your eyes can open if they were closed, and armed with this kind of idea of what we could be learning, let's actually look at the research that is out there on the benefits of yoga for the adult students. But before we do this, I'd love to have us recall just for a moment, what was your experience in massage therapy school? And my experience was at IPSB in San Diego. We practiced our skills of massage, but along with that in the curriculum was a Tai Chi form that we practiced as students. And I could see as a student the benefits of moving in the Tai Chi form was informing and helping me in the way that I was moving in the massage therapy practice, and balancing and weight shifting and some of the movements of moving energy with Tai Chi would help me in my career as a massage therapist. And this can also be done with yoga. And yoga, I found in my personal yoga practice that yoga can help us become open to change. In our first yoga class, in my first yoga class, the inner voice shouts, I can't do that. Especially when you see some yoga positions and some of these very experienced yoga teachers on Instagram, and some of their flows are just like, I am not that bendy. I don't know if my body will ever be able to do that. And it's that inner voice that is also talking to our massage students as we show them the depth and breadth of massage. They could very well be saying the same thing. I don't think I'll be able to do that, especially in the anatomy and physiology lesson. How am I going to remember and memorize all this in order to keep my clients safe and in order to take the NBLEX exam and pass it? But in yoga, after a few classes, we make progress. We're seeing how we're able to do more positions, maybe even asana that we didn't think we were capable of doing at the beginning. And we may begin to realize that many of the goals in life are achievable if we only keep a steady mind and keep on practicing. So let's look at the research and the benefits of yoga. So this research is going to be focused on yoga interventions, and specifically interventions with university students. These college-age students are also coming into our massage schools with many of the same problems. And the first one I hear from so many teachers, smartphone usage. How can I get the phones out of the hands of students? How can they use the phones effectively without kind of getting sucked in and attached to the phones, distracted by even the presence of the phone, so they're here and able to learn when they're in the classroom? And this research study found that university students who practice yoga may be less likely to use a smartphone excessively, as well as have uninterrupted sleep, than students who do not practice yoga. So what about yoga and engagement and readiness for tasks? How many times have we seen as a teacher, the students are in the classroom, and if they arrive in the classroom, are they able to learn when they're in the classroom? And the researchers found that the increased mental resources and alertness by breath work, which is a part of yoga practice, may stimulate active engagement and improve readiness for tasks. And designing a yoga program with a combination of breathing and postures facilitates psychological resources in stress coping. What about the big one? Yoga and academic performance. Is this going to help our students academically? So let's look at this study. It's called the Psychosomatic Impact of Yoga in Medical Education, a systematic review and meta-analysis. And the authors say that this study is actually the first meta-analysis to investigate the efficacy of yogic intervention on cardiopulmonary functions and psychological well-being in medical and dental students. Again, students that are having to take this medical advice and memorize it as part of their careers in preparation for having an exam. So the researchers found that the impact of yoga on academic performance of students is gaining recognition as an influential factor in their overall scholastic journey. Engaging in regular yoga practice has been linked to improvements in various cognitive and emotional aspects that directly contribute to academic success amongst medical and dental students. And why could this happen? It could be attributed to their enhanced mental ability, their reduced stress, and their better sleep quality. So what about processing information and that visuospatial working memory? Our students need this in order to succeed. And the research finds that yoga's emphasis on mindfulness and focused breathing techniques cultivates heightened concentration and cognitive clarity, enabling students to absorb and process information more effectively. Yoga enhances overall intelligence, visuospatial working memory, and attention in medical students. And the researchers found that yoga enhances fluid intelligence, general mental ability, and executive function. And the observed enhancements in general intelligence, visuospatial working memory, and attention are anticipated to have a positive impact on students' academic accomplishments. So yoga works in so many ways to make the body, the mind, the spirit ready to learn, and then also increasing academic accomplishments by helping the student process information and helping with their visuospatial working memory. So what about a huge problem that so many of our students have, anxiety, not only from their living their life as someone in the early 20s or 30s, but focused on all this information that we have to teach them in this short amount of time that they have to be able to know in order to protect their clients. So the researchers found data from over 3,800 medical and dental students, and they found that having a yoga intervention improves physiology outcomes such as the cardiovascular system and the respiratory system. And in addition, there's a significant improvement in reducing stress, anxiety, and depression, which may enhance the academic and social life of medical and dental students. So let's get more deeply into this and look at specifically the interaction between having a yoga practice and life stress. So let's look at another study, and this is the effects of yogic exercises on life stress and blood glucose level in nursing students. So they did a type of yoga practice called cyclic yoga. So that is incorporating Surya Namaskar, which is a group of yoga asanas that we'll talk a little bit more about later, and yoga nidra, which is a mindfulness practice. So in the research, they did 10 cycles of Surya Namaskar, which took them 20 minutes. They lied in the Shavasana pose for 5 minutes. And then they practiced yoga nidra, this guided meditation for 35 minutes. And they measured the nursing students' life stress by what's called the life stress scale for college students. And that looks at economy, interactions with their lover, faculty interactions, family interactions, thoughts of the future, their values, their grades, and interactions with friends. And they found that nursing students in the yoga exercise group had a significant decrease in their stress levels over a 12-week period, while those in the control group actually had an increase in stress levels. So we said earlier that they did look at blood glucose levels. They looked at postprandial blood glucose levels, and they measured that as a biochemical indicator of stress. And they found that after practicing yoga for 12 weeks, the blood glucose levels were significantly decreased in the yoga group. And the researchers stated that numerous studies have shown yoga to be an immediate downregulating effect on both the pineal gland and the hypothalamic pituitary adrenal axis responses to stress. And the performance of asana led to increased sensitivity of B cells of the pancreas to that glucose signal. What about yoga and memory and attention? Because our students have to have a good memory. And in order to memorize things, you have to be able to pay attention in class. And researchers found that yoga has been shown to improve other cognitive aspects of medical and dental students. For instance, the practice of yoga has been shown to enhance memory and attention. So we've looked at all this positive information about yoga and having a yoga practice as a student, but let's kind of get our arms around exactly what we're talking about. So what is yoga? According to the National Center for Complementary and Integrative Health, yoga is the most popular form of complementary therapy practiced by more than 13 million adults, with 58% of those adults citing maintenance of health and well-being as their reason for practice. So yoga, more often than not, will be something that the student has heard of before. But yoga is much more than what you see by these very advanced teachers and practitioners on Instagram. Yoga is a physical practice of mindfulness. It's not just being very flexible and being able to contort your body into different positions. Yoga is an ancient science of mind and body movement that originated in India. And it is a group of body and mind exercises that combines asana, which is the postures, the positions, breathing, and meditation. So these three in combination: asana, breathing, and meditation. So let's look at some research on exactly how yoga may work. So researchers reviewed 11 studies examining the effects of yoga practice on brain structures, function, and cerebral blood flow. And collectively, the studies demonstrate a positive effect of yoga practice on the structure and function of the hippocampus, amygdala, prefrontal cortex, cingulate cortex, and brain networks, including the default mode network. So yoga definitely has an effect on our brain. Yoga also has an effect on our nervous system. Researchers have stated that there's growing evidence to support the idea that yoga asanas improve health in different populations via downregulation of that sympathetic nervous system, that fight or flight, and the hypothalamic pituitary adrenal system. Yoga-based practices also regulate our autonomic nervous system, which is linked to depression and anxiety. We looked at that briefly before. Yoga improves the ANS balance by promoting the activation of parasympathetic nervous system, responsible for the body's rest and digest response, while inhibiting the sympathetic nervous system's responsibility for the fight or flight response. And this balance may enable yoga's stress-reducing effects. So what about yoga or exercise? And I personally say if someone feels so many positive benefits and they go to the gym and they lift weights and that's really what they do, then that's fantastic. But if someone is kind of turned off by the gym, they don't really want to go there, it's important to look at research on yoga as a form of activity that is beneficial for our students. And Ross et al. Concluded that yoga may be as effective or more effective than exercise in improving multiple factors related to both healthy and diseased populations' health, including reducing stress and fatigue. And yoga interventions are comparable to or superior to exercise in most outcome measures, while the emphasis on breathing, concentration, and the importance of maintaining posture is what distinguishes yoga from exercise. Like we saw in the slide before, it's that meditation, breathwork, and asana components of yoga that makes it so valuable and effective. So let's look briefly at mindfulness and intuition. And intuition is so important in so many people's massage practices. It's important in my practice. It's important, but it's difficult to teach students directly intuition itself. So how can we use yoga to help them develop their intuition? So let's look at the study accessing intuition and massage and bodywork therapies using mindfulness, knowledge, empathy, and flow. And this is published in the Journal of Bodywork Movement Therapies. And the authors say that due to the nature of the practice, there may be at times only a short discussion between the therapist and the client before hands-on work commences. So a lot of the communication in the two-way relationship of the therapist and the client is going to be nonverbal. And being ready to access this information, this nonverbal information, is important for the massage therapist when using their intuition in the clinic. And the researchers continue, when the therapist arrives at a treatment decision that feels like intuition, it's most likely to be the combination of environmental cues added to the therapist's acquired knowledge and own experience. So they definitely need to go to massage school. They need to have and draw upon their previous experience in massaging other people in similar situations. But it's this adding that knowledge and experience that we can really put our hands on with these nonverbal environmental cues that really sets off some really good understanding of what the client needs that we can attribute to intuition. So what is intuition in massage therapy? Some therapists appear to be more intuitive, the researchers say, and may adapt their treatment plan while hands-on, while others may appear to miss some of the information being communicated by the client, thereby having less knowledge on which to base their clinical decisions. And this is so important for our clients and for our massage therapists as we're teaching them, because we don't want too many of those situations where we think we gave a great massage and the clients really liked it, but when they walk out of the massage, their lived experience of what happened to them is different from what we think happened to them under our hands. And this may be because the intuition is not able to pick up on those nonverbal cues, and we're missing some of the information being communicated by the client to us, either before the massage session or during. So what is intuition in massage therapy? And the researchers continue their explanation by saying, encouraging therapists to cultivate mindfulness and have a greater understanding of their environment, they may be able to access their flow and their intuition. Participants can learn how to be more aware of their thoughts, feelings, and sensations, and learn to view those thoughts, feelings, and sensations objectively. They can learn to feel greater empathy for themselves and for others, and discover how to work non-judgmentally in order to listen effectively. So the key of this is cultivating mindfulness. Cultivating mindfulness in our massage students can help them have the greater understanding of the environment, can help them access their flow and intuition, can help them, mindfulness can help this non-judgmental mindfulness, present moment awareness, can help us to view our thoughts, feelings, and sensations objectively rather than getting caught up in the story of them. They can help us to feel empathy both for ourselves and others, and then work non-judgmentally. As we're non-judgmental to ourselves, we can be non-judgmental to our clients. Some more quotes from this fantastic study. By teaching therapists to be still, present, and empathic, information can quickly be gathered. Distracting internal dialogue can be filtered and set aside, and then intuition can appear very naturally. Successful students of intuition are those who have been willing to inquire within and cultivate patience and stillness within themselves. And mindfulness is a valuable tool that can help us build a bridge to intuition itself. And the researchers say to access intuition, we must first gain an education. We must have knowledge of our environment and the physical tools and techniques of our profession. And through mindfulness training, we can gain the ability to focus and create the right conditions for empathy for ourselves and for others. And this is going to make us more receptive and better able to listen. Let's switch gears a little bit now and talk about mindfulness and ethics. So there's a really great ABMP ethics continuing education class. It's titled Full Body Presence for Healthy Boundaries. And the instructor speaks about the skill of full body presence as a way to develop and enhance boundary awareness. And her definition of full body presence is the ability to feel all parts of your body and access present moment sensory awareness. And in this class, and I share the link right here below if you wanted to take the class, if you have ABMP as your insurance. And she lists the full body presence as being present in the moment, informs and discerns healthy boundaries for the massage therapist. Full body presence is used to discern ethical choices, and it's the foundation of the therapeutic presence of the massage therapist. And she cautions that trauma and stress can cause a disruptive body presence, which may lead to impaired boundaries, and having an open awareness is recommended. So now that we've looked at a lot of research studies on the effectiveness of yoga, we've been at this presentation for almost a half hour. So I'd like to switch to looking at breathwork, actual practices of yoga. We're looking at breathwork, at pranayama, and yogic breathing. So first, let's look at the difference of how we approach the breath if we're doing breath work versus if we're doing mindfulness. So in breath work, a central theme of yogic and meditative practices is the inclusion of deliberate patterns of breathing. So breath work is a deliberate pattern of breathing, and we're going to try a few deliberate patterns of breathing shortly in this presentation. And that's different from being aware of the breath or having attention to the breath that we practice in mindfulness. So if you sit down to do breath awareness and you're doing it from a mindfulness perspective, you're not doing any deliberate pattern of breathing. You're not trying to control your breathing at all. You're just bringing awareness to it and kind of following it as it goes in and out of the body. So mindfulness meditation involves bringing attention to the breath for the purpose of increasing awareness of ourselves in the present moment. And breath work is when we're actually controlling and doing deliberate patterns of breathing for the effect that it's going to have on our body. So let's look at some breathwork practices. And the first two we're going to consider are cyclic sighing, which emphasizes prolonged exhalation, and box breathing. So cyclic sighing is characterized by deep breaths. So we take a deep inhale and then we follow it by an extended, relatively longer exhale. And it has been associated with psychological relief, shifts in autonomic states, and the resetting of the respiratory rate. And here we see a great picture, a great illustration of the fact that our body already knows how to do sighing, and our body already uses the sigh as a way to relax itself, to let some stress go. And here's this very hard-working gentleman in this picture, very frustrated he looks like, and he's showing that he's giving a sigh as he's looking at his workload. So to practice this, determine it with a determination, specifically, we're going to do cyclic sighing, which consists of taking a two-part deep inhale and then a long, slow exhale. And research has shown that practicing this breathing technique can bring an increase in positive affect and psychological relief. So let's do it. We'll take a little 5-minute break after we've done just roughly about 30 minutes of this presentation. So I'll invite you to begin in a relaxed yet alert position, and your eyes can be open or closed. And I'll invite you to exhale fully. And then we're going to breathe in through our nose. And when your lungs feel full, take another shorter inhale through your nose to fully inflate your lungs. So just a little extra sniff. And then exhale very slowly. So inhale fully. A little extra sniff. And then a long, slow exhale. And I'll keep the time. We'll be doing this for about 4.5 more minutes. Inhaling. A little extra sniff. And then a long, slow exhale. Take one last breath in, a shorter inhale, and then a long, slow exhale. So we practice about 5 minutes of this breathing technique. And as your breath returns to natural breathing, just take a moment to feel inside of your body if anything feels different than it did 5 minutes ago. For me, I feel much calmer than I did before and much more focused. So let's look at the research on the results of cyclic sighing. And the researchers found that cyclic sighing produced the highest daily improvement in positive affect, as well as the highest reduction of respiratory rate, both significantly different from just mindfulness meditation. The physiological and psychological effects of cyclic sighing also appear to last over time. So the researchers compared and contrasted 4 different types of practices. So mindfulness meditation itself has many valuable effects on the body. So definitely practice it, but cyclic sighing can also be added to your toolkit and to your massage therapy students' toolkits. So we'll look at box breathing now, just briefly. Box breathing was also looked at in this research study, and it's characterized by an equal inhale, hold, and exhale, and then hold ratios. And it's been used by members of the military for stress regulation and performance improvement. So box breathing, we'll just do 2 rounds of it to show you very briefly. But we'll do an inhale of 4 counts and then hold the breath for 4 counts, exhale for 4 counts, and then hold the breath out of the body for 4 counts. So inhale, hold, exhale, and hold. Inhale, hold, exhale, and hold. So that was 2 rounds of box breathing. It's another type of breath work that has been shown to have benefits for stress regulation and been used for performance improvement. So let's look at another type of breath work. This one is called Nadi Shodhana. So a study looked at 60 medical students, and they participated in a 3-month intervention where they practiced pranayama for 20 minutes, 5 days a week. And their practice was they did 5 minutes of relaxation, 20 minutes of Nadi Shodhana or alternate nostril breathing, and then 5 minutes after their Nadi Shodhana practice of relaxed breathing. And the researchers measured stress with the perceived stress scale and also with the auditory threshold with pure tone audiometry. And what did they found? They found that this pranayama, this Nadi Shodhana, not only reduces psychological stress, but also enhances auditory perception, possibly through the regulation of stress hormones and improved inner ear functioning. And the study supports the use of pranayama as a simple, non-invasive intervention to reduce stress, which tends to improve cognitive performance in medical students. So reducing stress improves cognitive performance. And it also contributes to better academic outcomes and overall well-being. And they found that the significant reduction noticed in the auditory threshold is suggestive of possible improvement in auditory focused learning. So they're actually able, the ears are working better. They're able to take in sounds at a lower threshold. So why might there be an improvement in the auditory threshold? And the researchers posited that the noxious effect on the ear can be theoretically explained by the high level of blood catecholamines and exaggerated activity of the cochlear sympathetic innervation. So when you're stressed out, your ears kind of take a little bit of the brunt of it. Auditory thresholds get elevated with stress-induced cortisol secretion and vice versa. Less stress-induced cortisol secretion, a lower auditory threshold. And the stress hormone epinephrine has the potential to alter inner ear fluid homeostasis and thus also auditory perception. So it's actually altering the inner fluid, the homeostasis of the inner fluid when epinephrine is coming through our body, that stress hormone. And physical interference at times of stress to vibrations of the tympanic membrane by the tensor tympani may dampen the vibrations, which in turn ups our auditory threshold, makes it higher. So let's look at Nadi Shodhana. So you see the hand position this lady has. So we're closing off one nostril and breathing through the others. So we can use several hand positions, and this is one. You'll see the index finger and the middle finger are at the base of the thumb, and then the thumb is out and the ring finger is out. And you'll see right now her ring finger is closing off her nostril, and then as she goes to the other nostril, the thumb will close off the nostril. So we'll go ahead and practice it for 3 minutes, just a short time. So I'll invite you to once again sit in a comfortable yet alert position with a straight spine. You can close your eyes if you've done this practice before, if that feels comfortable. But if not, the guidance is on the screen for you. So if you get lost, you can look at the directions. And we'll begin by just taking a few diaphragmatic breaths. And prepare your right hand by putting it in that mudra, that hand position. The index and the middle finger at the base of the thumb. And we'll start by closing off the right nostril with a thumb, and we'll actually inhale with the left nostril, and then exhale through the left nostril. And we'll begin by inhaling through the left nostril, closing the left nostril with the ring finger, exhaling through the right nostril. Inhaling through the right nostril, and then closing the right nostril with the thumb, exhaling through the left. And we'll just follow these directions over and over again for 3 minutes. Inhale through the left, close the left, exhale through the right. Inhale through the right, exhale through the left. And I'll leave you to repeat this at your own pace, I'll keep the time. And we'll go through one last round. We'll have you exhale through the left nostril. Inhale through the left nostril. Exhale through the right nostril. Inhale through the right nostril. And exhale through the left nostril. We can release our hand and take a few deep breaths through both nostrils before we end the practice. And I'll invite you to just take a moment now to feel any difference in your body, your mind, your spirit, just with this short 3-minute Nadi Shodhana practice. And we have to understand that not all of these practices are for all students. Before I had a rhinoplasty, I had a deviated septum. It was very hard for me to breathe through my right nostril, and that happens to a lot of people for a lot of different reasons. So it might be only fully accessible for some of your students, and definitely when you have cough and cold, flu season coming in, when everyone is stuffed up and has the sniffles, alternate nostril breathing may not be as comfortable. So let's look at two more breathwork practices. Kapalbhati emphasizes a forceful exhalation, and diaphragmatic breathing emphasizes the use of the diaphragm. So Kapalbhati is a fast or high frequency. It has approximately 1 to 2 hertz frequency breathing technique in which short and quick, vigorous exhalations are performed with effortless inspiration. So we're going to concentrate on breathing out and let our body naturally breathe in. And it's been reported to improve cardiovascular, respiratory, mental, and physical health on different parameters. And Kapalbhati among people who are practitioners of yoga, I say it has very good riz, as the kids say. It is thought to create an abundance of positive effects on the body and the mind. So Kapalbhati is from the word kapal, means skull or the front of the head, and bhati means shining. So you may also hear it called skull shining breath. So we'll just do this for 30 seconds. So I'll invite you to sit in a comfortable yet alert position with a straight spine. You can close your eyes if that feels comfortable and you've practiced Kapalbhati before. Start by taking a few gentle breaths through your nose and place a hand on your abdomen over the navel. And we're going to be inhaling through the nose and then exhaling forcefully using our diaphragm to breathe out. So we're inhaling naturally, exhaling forcefully. And we're going to repeat it at a repetition of about 60 times per minute, but we're only going to be doing it for a minute, and then we'll do one round and then breathe naturally for 30 seconds, and then we'll be done. So I'll invite you to inhale naturally and exhale forcefully. We're about halfway done. And then if you haven't already stopped, go ahead and stop. Place both hands on your thighs and relax. And we'll take the next 30 seconds to breathe naturally. And take a last natural exhale. So if we were doing this as a more intense practice, we'd repeat for 1 or 2 more rounds of up to 60 breaths with 30-second rest periods in between. And again, take a few deep breaths through the nostrils before ending the practice. So this is like we saw in the slide, it's a high frequency breath practice. So I will find that because of the increased of blood gases, my toes and my fingers may feel tingly. And if slow breathing happens after the practice, that usually the blood gases kind of equalize. So I'll invite you to just take the next few breaths to feel how, if anything, feels different from your body just by doing the short 1-minute breathing practice in your body, mind, and spirit. And then we'll move to diaphragmatic breathing. It's used as a part of body mechanics for massage therapists. According to this researcher, if a massage therapist feels back pain during the session, the recommendation could be that become aware of your breathing pattern and slowly bringing it back to deep, slow respirations, characteristic of diaphragmatic breathing. We're bringing awareness to our body mechanics, and that can therefore reduce back pain. So remembering, because as a lymphedema therapist, I saw firsthand, not everyone knows how to naturally diaphragmatically breathe. As we get out into older childhood and teenage years, the focus is on, having a flat stomach, and we could have been made fun of on the playground for puffing our stomach out as we breathe. So we kind of don't use the diaphragm as natural as we do when we're a baby or an infant. Seeing an infant breathe, you can see their chest and belly rise and fall. And that's how our diaphragm naturally works as a muscle. An inhalation, it contracts and moves downward, and at exhalation, it relaxes and moves upward. So how might breathwork work to help our students? Nasal breathing has been shown to entrain high-frequency oscillations in the amygdala and hippocampus, 2 nodes involved in emotionally processing in the brain. And nasal breathing also affects the central nervous system differently than mouth breathing. Nasal breathing synchronizes electrical activity in the olfactory cortex as well as the amygdala and hippocampus, and mouth breathing doesn't do that. So 2 very good arguments for breath work and specifically breathing through the nose. Researchers have also found that breathing rhythms have been shown to directly modulate behavioral and physiological arousal in mice through the activity of the locus coeruleus, where experimentally induced slow breathing patterns have been associated with calm behaviors. Thus, slowing down the breathing rhythm with sighs can signal higher order brain structures associated with behavioral arousal and promote a sense of calm. The breath can also enhance our interoceptive processes. Interoception, the sensing and processing of visceral stimuli through the ascending branch of the brain-body axis, resulting in conscious perception of bodily processes, plays a role in emotional experience, self-regulation, decision-making, and consciousness. And the perception of our internal physical processes has the potential to amplify or modulate stress. And breath work is also a form of stretching. During controlled breathing exercises, stretch of the lung tissue produces inhibitory signals in the vagus nerve, which ultimately shifts the autonomic nervous system into parasympathetic dominance that results in a calm and alert state of mind. And what about breath work and well-being? Increased melatonin production after a regimen of slow breathing pranayamic exercises has been attributed to pranayama's tendency to create a sense of relaxation and well-being in the subject. So let's look at how we might fit this into self-care for the massage student. What are some possible elements of yoga practice for massage students? The first one is breath work, connecting with the breath. And maybe you've already gotten kind of interested, whether you're a massage student or a massage teacher, some of these practices that we've practiced with breath work, how can you fit them into class? How can you fit them as a student, as a practice? Maybe you come 5 to 10 minutes early to class. Maybe you're during your break. Instead of being on your phone, you're doing some of these breath work practices. How can we add breath work into the day as a massage student to improve concentration, to reduce stress? And also asana. There's several specific ways in asana that are, I think, very beneficial to someone who is learning massage therapy. First, range of motion, checking in with the joints, having the asana have a range of motion effects. And this particular practice, Sukshma Vyayama, is a set practice that is moving the joints of the body. Also, crossing the midline, some of these twists that we do in yoga, crossing the midline when our hands are crossing our midline, our feet are crossing our midline. The brain, left and right side of the brain has to work together when we cross the midline. So that's improving brain teamwork. Surya Namaskar is again a set of asanas that focuses on flexion and extension. And with it, we're partnering breath work and feeling the body move. And also balance and weight shifting. A lot of yoga is balance positions. Postural, it can improve postural stability. And often in massage therapy, we're working in positions where both our feet aren't flat on the ground and our center of gravity is directly over our feet. We're working and moving around that massage table. So we need to understand how to balance and weight shift. And also Shavasana, what I call the intuition position. Shavasana is at the end of the yoga practice, and we can't skimp on it, because that is where the mindfulness, the present moment awareness, the interoception comes into our yoga practice. And then also yoga philosophy, understanding the yamas and the niyamas, the different way that yogic philosophy understands the body, understands the care of the body, can be very influential in improving the richness of our massage practice. So let's look briefly at Surya Namaskar. So this is a set of yoga postures that is performed as a sequence, and you'll see the different postures. And if you look at them as we go around the sun, it's flexion, the body's in flexion and extension, flexion and extension, flexion and extension. So there's alternate forward and backward bending movements, and it's also paired with alternating inhalations and exhalations. So this is such a wonderful practice. And if you are maybe overwhelmed by the wide variety of yoga poses and how every single yoga class seems to be extremely different, how could you possibly kind of master something to the point where you feel confident in it? Surya Namaskar is a really great set of postures that the student can practice over and over again and start to feel confident in this practice. So here's some research on Surya Namaskar. It's the most widely adopted sequence of asanas, which has an origin from the Indian traditional physical training. It's a complete practice involving asanas and pranayama, the breath work, alternative stretching and compression at the abdominal area. It works the spine, and increasingly mobility of joints extends muscle power and vitality. It meets nearly all the criteria of the American College of Sports Medicine's current guidelines in terms of type of exercise. It's aerobic, resistance exercise, flexibility, and proprioceptive and neuromotor exercise. And with purposeful frequency, intensity, time, and volume. So if you do it with sufficient frequency, with the intensity, enough time, and enough volume of this practice, it actually meets a lot of current guidelines for ideal form of exercise. So this is just the listing if you want to know the specific poses, both their names in Sanskrit and their what is actually happening, or their American names that we would understand. And let's look into the final study technique that I have for you, and that is the Pomodoro technique. I really love this, and I think it is a way to help students study more effectively, because we can see that we can give the student all the resources and all the checklists and all the flashcards and all the coloring books, but if they're coming back to us and saying, like, it's just not sticking, it may be because of how they're studying when they are at home. So the Pomodoro technique is a time management technique developed in the late 1980s, and it is not a way of studying material, but a way of time management, managing one's time. And this method consists of studying in intervals, a period of study followed by a period of rest. And it's called Pomodoro technique because the person who developed it actually used a kitchen timer, and the kitchen timer was in the shape of a tomato. So it keeps the time, and it was shaped like a tomato, so he called it the Pomodoro technique. And the Pomodoro technique is 25 minutes of focused study, and then you take a short 5-minute break. And we actually already did this in this presentation. We did our first 25, 30 minutes of looking at the research, and then we took that 5 to 10-minute breath break. And you would repeat this study break cycle 3 more times. And then at the end of that 3 cycles of 25 minutes of study, 5 to 10 minutes of break, you take a longer break of 25 to 30 minutes. So what does research show on doing this? Because what we'll feel from our lived experience of studying is, I study until I feel like I can't study anymore, and I think that my timing, would be unnecessary to look at it. I feel like the timing is fine. I just need better resources, right? But what the research has actually found is that students that had longer study sessions and longer breaks when they're self-regulating have higher levels of fatigue and distractiveness and lower levels of concentration and motivation compared to students that had these systematic conditions. And they found that there's no difference between both groups, the ones who set their own study and break time and the ones who followed the Pomodoro techniques, in their invested mental effort or their task completion. So they invested the same amount of mental effort, had the same amount of task completion, but if you set your own study breaks and don't use a system, you have higher levels of fatigue, higher levels of distractiveness, lower levels of concentration, and lower levels of motivation. So it's worth it to use a systematic studying technique. And the researchers found that taking predetermined systematic breaks during a study session had mood benefits and appeared to have efficacy benefits, similar task completion, but in a shorter time over taking those self-regulated breaks. And it's true because you think about what is in a study break, especially now that I'm studying now in continuing education classes, when I was studying in massage school. Have you ever picked up your phone just to look at social media for just a minute to take a break from studying, and suddenly it's 40 minutes later? The things that distract our student are going to be made and engineered to distract them for as long as possible to keep them on that app. So what we can offer our students instead is a mindful movement break, so they can keep to this Pomodoro or similar systemic studying schedule. And I have something, this is a passion of mine. I have something called Yoga for Massage Therapy Students, and it provides students with a 5 to 10 minute and 25 to 30 minute mindful movement breaks within their study sessions. So I'll invite you to get on the mat and try it out. There are short yoga sequences to develop interest in fostering a more robust yoga practice, and that's at bit.ly/yoga study break. And if you're an oncology massage therapist, as a yoga instructor, I've also had a series called Yoga for Oncology Massage Therapists, and that's at bit.ly/yoga4OMT. And that is some yoga poses taken from published research protocols for cancer survivors and people with lymphedema. But for our students, bit.ly/yoga study breaks has some shorter yoga sequences that they can plug into those Pomodoro study breaks. So we need to understand that the short study break classes are short yoga and breathwork practices. They're a part of the student's yoga practice, but not the student's entire yoga practice. All of the research studies that we looked at involved a way more robust yoga practice. And we need to know that yoga is more than just asana. Ideally, the students will develop a deep interest in learning more about yoga and practicing for a lifetime. And I also have a full free 10-session breathwork and lymphatic wellness class here. If you want to learn more about pranayama, more about yogic breathing, more about breathwork, and that is on my Stress Reduction for Lymphedema YouTube channel. So I'd like to end today's practice, as we're just a little bit over an hour now, with another mindful moment. We have shared so much information, practiced so many different types of breath work in the last hour. I'll have us just take a few nourishing breaths and bring to mind what we learned today. What were some things that you were surprised to learn? And what are some things that you're looking forward to adding to your own massage therapy student self-care practice, or in your classroom as a massage therapy teacher? And are you excited at looking at some of these little yoga break study classes and incorporating them into your own self-care? And I'll have us finish by taking one more deep, nourishing breath in and out. And thank you so much for watching. I'll invite you to follow me on Instagram at Stress Reduction for Lymphedema. I have a lot of information and resources on mindfulness, and my other presentations are at KathleenHellenListen.com. And my YouTube channel with a lot of mindfulness videos is YouTube at Stress Reduction for Lymphedema. And these are the resources. And thank you so much for watching. I look forward to hearing your comments on this video and seeing you in some other of the yoga study break videos. Thank you and have a great day.